Hello everyone, this is Paul from Ortho Eval. Today I want to talk to you about radial nerve gliding. Now, when you do radial nerve glides, it's important that you don't try to push through these too hard, that you do them nice and gently, nice and slowly, and you'll get more benefit out of it. Now, why do people have to do nerve glides? Well, sometimes people will have an accident, or maybe they'll be in a sling or immobilized for a long period of time, and the nerves that go from your neck down into your arm get a little bit stiff and tight and stuck between soft tissues. So the nerve likes to be able to glide back and forth, and if it doesn't and it gets stuck in the soft tissue, it will get pulled on. And when it does, it can cause pain and tingling down the arm and mimic other types of problems. Okay, so what we're going to do is demonstrate how to do the radial nerve glide now. So what you do is you keep your arms equally apart here, shoulders, level. You take the affected side and reach down toward the floor. While you do that, you bring the hand back like you're accepting a tip from somebody, and then you bring the arm out to this side. Now you're going to stop when you feel this kind of a sharp pull go through the back of your arm. You're going to stop right there, okay? And that you need to try to measure on your own so that you know how high you're able to get. So that once you do the exercises, you can retest this afterward. So here's how you do it. You reach down, hand palm up toward the ceiling, you bring the arm out to the side, and then what you do is as you let the hand go back, you tilt the head to the opposite side. You bring the hand back and tilt your head toward the hand, and then back and forth 5 times, essentially making that nerve slide back and forth to help give it some better mobility. Once you have done 3 sets of 5 repetitions, then you should retest yourself again. So drop the arm, bring the hand back, take it out to the side while the head stays in a neutral position, and see if that arm gets up a little bit higher before you develop that tightness in your arm. If you did get higher, then that means that nerve is gliding better and moving better, and typically you'll feel like you have better mobility in your arm after you've done that. So I hope you liked today's video. Make sure you give us a thumbs up and be sure to subscribe to our channel. If you have any questions, leave those questions in the comment section of this video. I'll do my very best to get back to you. Thanks.